COVID-19 plunging many economies into turmoil around the world. It's caused massive job losses and slowed down the GDP growth of countries globally. A new report says G20 nations like South Africa, India and Brazil are set to face far worse economic consequences than those of their Western European and East Asian counterparts. Well, to discuss the challenges is Professor Patrick Bond from the University of the Western Cape. Prof, good morning and thank you very much for your time. When you read India, South Africa and Brazil, I'm thinking, what about Russia, what about China? But it looks like Russia and China are going to do much better than us.
Yeah, thanks, Dan. It's great to be with you and all your viewers. And although Russia is actually in the top 5, along with India, Brazil and South Africa, the US being the worst in managing the crisis, there are some very important differences. The three mentioned it, particularly a consultancy, Whereas Maplecroft has highlighted in the G20 the 20 richest countries or 20 most powerful that have been chosen to be in a club. Really in 2008, once the world economy melted down, this club, G20, was put together. It's much bigger than the G7, the normal sort of Western powers. And you're right, the 5 you've added China and Brazil and Russia, are the BRICS, the Brazil, Russia, India, China, South Africa bloc. And we had certainly hoped that not only the 3 countries with very dense packed urban areas, massive poverty and inequality, Brazil, India, and South Africa, that have been doing very poorly in managing the spread. And the infection is, for example, in South Africa, moving quickly in Combi taxis because an extra 3 billion rand was not provided to the Combi taxi lords, so as to reduce the capacity from 100 down to 70, or ideally to 50%. It's that fiscal austerity that's gripping in 3 quite conservative countries, whereas in China, they've had both a commitment for the fiscus to open up to spend more to deal with the virus, plus very strong surveillance and tracking. And in Russia, they are not handling it very well. And indeed, Russia was meant to host the BRICS last month for a heads of state summit. But you know, all 5, Dan, were meant to have a vaccine research center plus a contingent reserve arrangement. The vaccine center was announced here in Johannesburg in the Stanton Summit in 2018, and the contingent reserve arrangement, a kind of IMF substitute, was announced at the 2013 Durban Summit. But these haven't been activated for reasons I don't even understand. It's just one of these illogical things.
This risk consultancy, Verisk Maplecroft, I mean, as you mentioned there, it's got this recovery capacity index that's showing that India, South Africa, and Brazil must expect or can expect the harshest repercussions from COVID-19. They are at the bottom of that risk list, and they are in for a drawn-out economic recovery. What are the prospects, Dee?
Well, they're very weak because the world economy, in which we've become sort of addicted to exporting minerals, is in terrible shape. China has recovered, but it's only growing 2% this year compared to the normal 6-7%. India will collapse, and they were running at 7.5%. Those were 2 of our major, let's say, sites of demand for the iron ore, the coal, the platinum that South Africa exports. So we have a very shaky base for exporting to the world economy. And Brazil is the same. Especially Brazil has been a petroleum exporter, and the price completely collapsed. So I think there's some vulnerabilities. There's also internal, as I said, the cities are sites of massive infection transmission, but also the health systems are very fragmented. They're like the United States, private insurance instead of a national health system. So that means we just don't have a very good way to.
And when you mentioned, Prof, when you mentioned the health system, I'm thinking about NHI. Seemingly there'd been some progress made. Remember, just before the outbreak here, we had meetings with the health minister, Dr. Zweli Mkhize, and his colleagues in the Department of Health, like Dr. Anban Pillay, were telling us as a nation how this NHI thing is going to work out, is going to be set up. Do you think NHI is going to have to be pushed back?
Well, I hope it is pushed forward, because it's obviously come way too late to rationalize all of the health resources that we've needed. And that's why we had such a deep, extreme lockdown, because the health system wasn't ready. But you know what's really been the holdup for more than, well, 12 years, right? In fact, 13 years they announced in Polokwane in 2007. It's that the Treasury's only been willing to fund a few pilot projects, quite tokenistic. So we really haven't had the commitment to tackle the big, powerful interests like Discovery Health. I hope they're not one of your advertisers, but you know, those are the big boys that have stopped the NHI from really moving forward. So we desperately need it. Like, say, in Spain, they actually had to nationalize all health services to make sure that they got.
Well, I mean, it doesn't matter. It's not about who advertises. It's about the fact that that whole medical aid fraternity or sector has been engaging with government, progress. And there's been, they've been part of those discussions. But it's not what we're discussing really now. But I'm just fascinated because if we have a weak road ahead, a drawn-out recovery, according to Verick's Maplecroft's report, then you wonder how such things like NHI are going to pan out, and maybe if there's a political will or not to move it forward. As you say, we'll have to ask Dr. Zweli Mkhize, but your sense is things like that might assist.
Well, that would definitely assist, but certainly the other four things that the presidential economist, Trudy Makhaya, just announced last week would be so welcome. One would be developing the infrastructure, 2, greening the economy, 3, trading within the continent more, and 4, rebuilding communities with more public service. Now, each one of those four things that Makhaya and President Ramaphosa have committed to is working towards making us more resilient, and that would make South Africa's recovery much stronger and more fair. But the problem is austerity from Treasury is blocking on pretty much all of them, plus the border controls that prevent business from really working and the African Continental Free Trade Agreement from going forward.
They're going to have to find each other around those issues. Finally, and very briefly, Prof, before I let you go, one of the factors that are mentioned in this Verick Maplecroft's report on this index, the Recovery Capacity Index, is an effect of corruption in parts of the world. They talk about corrupt, ineffective and unstable governments will limit the ability for the economies to recover. We are not unstable as a country, as a government, but we have issues with corruption in the public sector. And that's something that might even cause more harm for us as we try to recover.
Yes, now let's just put it in perspective, because all those countries, Brazil, India and South Africa, are named as being weak on governance. And it's really two things. Verick Maplecroft, which is a corporate consultancy, is concerned with state corruption. South Africa ranks in the Transparency International survey, the main perceptions of corruption, the 70th worst, in other words, 110th on the list. That's a fairly mediocre ranking. Our corporate corruption, according to PwC, which does a biannual survey called the Economic Crime Index, which includes corruption, bribery, illicit financial flows, we actually rank number 2. Number 1 is India. So you can see really that like you're going to do with the study of the 2010 World Cup and the construction companies that colluded and profited and just got away with it, we really have to get a handle on our corporate corruption, especially illicit financial flows, where we're losing about 400 billion rand a year in illicit outflows. That's something Treasury has even openly recognized. The Reserve Bank and Treasury haven't been very good on that front. So yeah, and the second thing on the governance front, Dan, just very quickly, is social unrest. And there South Africa does actually rank, even though we have a stable ANC government, but like Brazil, like India, very, very strong levels of unhappiness in the society and a willingness to go to the streets. So your first and your second stories this morning, Nahawu on the strike at the testing lab, the Amadiba Crisis Committee blocking SANRAL, it really speaks to whether the country's leaders are listening to the base, doing the kinds of things like providing health workers with the support they need, providing communities with the infrastructure they need, not a big toll road to promote mining for an Australian company, which is what is understood with the SANRAL project. That would be a set of the lessons, right? Will the top leaders finally listen to the base, which is a very, very angry set of communities, workers, social movements, students, healthcare activists. We have a very angry society that Verick Maplecroft also rates us very low on the governance sides, where we should be able to improve.
It's a long road ahead, and all those issues are going to be very important. Thank you very much, Professor Patrick Bond, for your insight this morning here on Today.